are now listening to Your Health Matters with Miss Dionne. I am the owner and founder of Missouri Home Health and Therapy. We have been providing extraordinary home health services in the comfort of your home since 2005. Please give us a call at 314-524-3958 if we can be of service to you. Listeners, Father's Day is coming up, and in honor of Father's Day, today we are having a special men's health segment. Now, this segment is not only geared for men, it's for everyone that's listening, men and women, because all of us are associated with a loving male in some shape, form, or fashion. So listeners, today we have a special guest, Dr. Otha Myles, with us today to discuss men's health. Dr. Myles, how are you doing today on this beautiful evening?
I am doing great. I'm very excited about Father's Day coming up. I have two daughters, and I'm hoping they're listening and they're getting ready for it as well.
Yeah, that's wonderful. So tell us a little bit about yourself.
Well, Dionne, I am an infectious disease physician. I currently work at Mercy Hospital. I'm also owner and manager of the Myles Medical Consulting, where I do some programs like Brother to Brother down at Roosevelt High School, talking to young men about HIV and AIDS and STDs and things like that.
Wonderful, wonderful. So we're getting ready to go into this men's health so we can encourage the listeners and enlighten the listeners on everything as far as getting their healthy lifestyle better or to a point that's going to help them add life to their longevity to their life.
All right.
Okay, so what is the overall condition of men's health in the United States?
Well, Dionne, unfortunately, the overall health for men have been steadily declining.
So why is that happening?
Well, mainly due to factors like poor health education, lack of awareness, and some culturally induced behavior patterns. You know, a lot of us have been taught from being boys growing up that we're just socialized that men don't cry, or boys don't cry, or men don't go to doctors. That's something that the wives do or the other women do. So a lot of that has to be kind of changed if we're going to do better with what we're doing right now. And there's a limited amount of male-specific health programs when you look at what's out there for women with breast cancer screenings and things like that. It's not the same for men. So men tend to visit the doctors less often than women, and therefore they fail to detect many of the diseases at an early stage.
Yeah, that's pretty bad. Mm-hmm.
Right, so right now we really are saying that we have a silent health crisis going on in men, facing higher mortality rates than women for the leading 10 causes of death, in addition to a shorter lifespan.
Okay. So do you want to elaborate a little bit more on some facts in regards to...
Absolutely. Men die on average 6 years younger than women, and probably people will say that's from a lot of different things, but that's just a fact of that's out there right now for men's health. Men are about 40% more likely to women to die for colorectal cancer. Men are about 90% more likely than women to die of lung cancer, twice as likely as women to die of heart disease, and 50% more likely than women to die of cancers. And of course, you know, men are more likely than women to die from diabetes and kidney disease as well.
Okay. So who should be concerned about this silent health crisis?
Well, of course, all men should be concerned, but this also affects women who care about the health of the men in their lives, such as their fathers, their husbands, their sons, and maybe even brothers. When men neglect their health, it affects the families, the communities, and the employees. Employers lose productive employees and pay the cost of their medical care, as well as society, which absorbs the massive cost of premature death and disability.
Right. Just like I suggested earlier, that this show is not only for men.
Exactly.
This is for everyone that's listening, because we are all associated with a man in some type of way, and we all need to work together to help the man be more proactive in their health care.
That is true. That's right. It impacts everyone.
Yes, sir. So what can be done to combat this problem?
That's a good question. I'm glad you asked that. Women, spouses, and others with a male in their life can help them understand the importance of healthy lifestyles and health-seeking behavior. Research has actually shown that women strongly affect the health decisions within their families. And I can certainly tell you in my family of 16, I'm the 14th of 16 kids,
Wow.
my mother was on it. She made sure that my father got his health care and that the men in our family got health care as well, to include all the children. So that includes an emphasis on health of the spouse and the younger males who are forming attitudes about healthy lifestyles.
Right, that is so, good information, because the woman plays a huge role.
Exactly.
From the time that the child is born.
Exactly.
All the way up until adult age.
Exactly, when they're able to make their own decisions for them. So if the mother has done her job correctly and placed that value on good health care at a young age, then typically the sons and men will continue to do that as they go on in adulthood.
Wow, listeners, women, you have to, stand up to the plate and
That's
take
right.
care of your men.
That's right.
So tell us about National Men's Health Week.
Oh, great, yeah. National Men's Health Week was passed in Congress in 1994, and then it was signed into law by President Clinton. It's celebrated each year during the week that leads up to and including Father's Day, usually in June.
Okay, so listeners, if you want a little bit more information about Men's Health Week, go to menshealthmonth.org. That's MENSHEALTH month.org for a little bit more information and insight on National Men's Health Week.
Good.
Okay, doctor, what are some top health concerns of men?
Well, according to the Centers for Disease Control and Prevention, or the CDC, health disease is the leading cause of death in 2006. Believe it or not, about 315,000 men died from heart disease in 2006. The top leading causes of death for males of all races is heart disease and cancer. And the most commonly diagnosed cancer for men is prostate cancer, lung cancer, colon cancer, rectum cancer, and bladder cancer. Things like cigarette smoking has to be looked at also. In 2007, the smoking prevalence in men was about 22.3%, compared to women was only 17.9%. And I cannot go without saying something about HIV and AIDS, because as you know, I'm an infectious disease doctor, and that's my expertise area. About 3/4 or 75% of newly diagnosed HIV AIDS cases in 2007 were of men. So there's lots of work out there for us to do.
Yes, those are interesting facts, and we need to get down to the nitty-gritty is trying to figure out why are these problems within the African American community are still existing. So, doctor, are there any special health concerns for African American men?
Unfortunately, there are. African American men are about 30% more likely to die from heart disease compared to non-Hispanic white men, and unfortunately that's just a fact. And then again, about HIV and AIDS, there is a disparity out there. Blacks, as you know, account for about 13% of the United States population. However, they account for about half of the people who get HIV and AIDS.
Wow, that's a very interesting fact. So, doctor, now you spoke on African American men having a higher percentage rate of leaving us at an early age due to heart disease and cancer. Do you have any recommendations for any nutritional guidelines for men? And how do they change as men age? Now, listeners, this is a medical disclaimer.
Yes.
We're just giving recommendations right now. So at a later segment, we're going to probably expand on this a little bit further.
Yes, I am an infectious disease doctor, so I'm not going to go too far out in talking about nutrition. But as doctors, we all know a little bit about nutrition. And I'll be happy to bring someone back with me who can talk into more detail. But the optimal nutritional needs does differ based on gender and other factors like how active the person is, what the age of the person is, the body size, and things like that. But if we just talk about things like calories, for example, a moderately active 125-pound woman needs about 2,000 calories a day versus a 175-pound man needs about 2,800 calories per day. So more calories are needed for that same active male than is for that female. When you look at things like protein, we all talk about protein and things that we want to eat. both sexes require about 60 grams of protein a day, and that averages out to be about 8 ounces of chicken or about 6 ounces of canned tuna. But be careful, excessive dietary protein can increase your calcium loss in the urine, and that can lead to kidney stones, especially in men. When you talk about things like carbohydrates, you need about 45% of those 2,000 calories that I told you about before. They need to come from carbohydrates. And we're talking about complex carbohydrates high in fiber, unrefined foods like bran, cereal, whole grain products, and not that white rice that you may get, but you want that brown rice, and you want beans and legumes, the things that your mama cooked for you when you were little, and I know I certainly ate a lot of. And then things like fruits and vegetables. Men need more fiber than women, about 38 versus 25 grams a day before the age of 50, and 30 versus 21 grams a day thereafter.
Okay, wonderful. Very good recommendations, doctor. So we're going to go to the next question is about this belly fat. I'm sure there are men out there wondering about their belly fat. So what diseases does having belly fat put men at risk for?
Well, it's interesting that you asked that question, Dionne. Dangerous belly fat is also known medically as visceral fat. It is located beneath the muscles in your stomach and poses many dangers to your health if there is too much of it. Now, sedentary people who are not moving and not active, this belly fat can lead to increased blood lipids and fluctuating sugar levels and insulin levels, resulting in conditions such as obesity, diabetes, heart disease, and even cancer.
Wow. Okay, so listeners, after all this information that you all have received today, you all should be really thinking about getting an annual wellness checkup, going to see your doctor on the regular. So, doctor, what are some of the top issues that the doctor might address during a male annual wellness visit?
Yes, annual visits. That's what we want to push for all of our males out there. We're hoping the women and other people in their lives will help them to go in to see their doctors. When you go, you're going to be counseled on a lot of different things to include smoking cessation, limiting your alcohol intake, reducing risks for STDs and HIV screening, talking a little bit about lipid screening, colorectal cancer screening, and even immunizations that may be appropriate based on your age or what interval in life you are at. They're going to do a physical exam, and on that exam, they're going to do a blood pressure screening and probably a body mass index screening to see how big that abdomen is. They're going to look for chronic disease screening like diabetes and lipid screening. They maybe even do a AAA screening looking for aortic aneurysms. Lastly, they'll probably look at immunizations.
Okay, wonderful. So listeners, I hope all this information that we tried to get into this segment helps you all out a little bit.
Lots of
information. So like I said, we're going to talk a little bit more in a different segment. So Dr. Myles, do you want to give your information of how they could possibly reach you if they have further questions?
Sure. Again, my name is Dr. Otha Myles, and that's with an Y, M-Y-L-E-S. I'm an infectious disease specialist, and the name of my consulting company is Myles Medical Consulting, and that website is www.mylesmedical.com. MYLESMEDICAL.com, or you can reach me at Mercy Hospital.
Wonderful. So if you have any other questions, or if you need any healthcare services, please give me a call, Dionne, at 314-524-3958. Thank you.